Local programming on KRWG made possible in part by viewers like you. Thank you.
This is KRWG, TV, radio, online, news that matters. Now, across the Mesilla Valley and the borderland, the stories that shape our community. From the KRWG Broadcast Center at New Mexico State University, this is Newsmakers.
Thanks for joining us on this special edition of Newsmakers. I'm Fred Martino. My guest today is the author of the book, Conversations for Paco, Why America Needs Healthcare for All. Dr. James Lenhart is a physician from Tacoma, Washington, and recently spoke about this issue in Las Cruces. Dr. Lenhart, thank you so much for being with us.
Thank you for inviting me. I'm honored. It's a real pleasure.
Great to have you here. So I want to start off by giving you a chance to talk a little bit about your book and how this project came together.
Well, my author role model is John Steinbeck, and for years and years and years, I just love to write something like The Grapes of Wrath or East of Eden, and some really compelling literature and a novel, because much of what he did was about society. And in my career, what I've witnessed is inequality in healthcare, inefficiency in healthcare, marginalization of minorities as well as people with proper outcomes and incomes and so forth. But the debate that went on in 2008, 2009, and 2010 with Obamacare really fueled what I wanted to do, and that was to get busy and write this work. When we talked on radio, you said, well, why don't you just do this? Why don't you just write something that's non-fictional, that's spreads all the stats out and helps people understand healthcare in America. And what I told you, and what I still believed, is most of that kind of stuff puts people to sleep, and I wanted to wake people up.
Yeah. What could be more dramatic than healthcare, because it is life and death. I mean, this is very serious stuff, and you, being a physician, have seen that in your career, the real life aspect of that.
I've not only seen that, but I've also witnessed the behavior and the compassion of many physicians, and we have a lot of good ones, but there are some that often aren't kind, aren't nurturing, and aren't understanding of their patients. And so this was also about taking many of the characters that I've worked with, the patients that I've cared for, and put them into this work. And so everything in it is for real.
Yeah.
Of course, the characters are not, because you have to, protect the innocent. You couldn't name the people per se, but at any rate, that's what it's all about.
Yeah, but you've been influenced, to get
Right.
those stories through real life experiences. Folks can find the book on Amazon.com, and I read a lot of wonderful things that people said about the book and the issues that you cover in the comments about the book. But as I said, there are so many striking things about this issue, and we talked about some of them on radio. I have covered healthcare for a very long time, and even did a documentary on healthcare in my last job more than a decade ago. And one of the things that really stuns me about this issue is that, unlike so many controversial issues, this one, the very idea, the very thesis for why we have healthcare the way that we do is this notion of the market is always right and the market is most efficient. When in fact, with healthcare, it is just the reverse. And every time I look at the numbers, they get worse. And the latest numbers that I found from the Organization for Economic Cooperation and Development show, in 2015, the most recent numbers available, per capita spending in the US on healthcare, as you know, was over $9,000, which is 3 times the average for the world. Britain and Italy spend less than half and have a higher life expectancy. You were talking about this with me on the radio. What do you say to people? I mean, you're traveling the country, including in Las Cruces, talking about this issue, and what's the reaction that you get?
Everything in the United States is best. And we hold on to that so fervently. It's like we've got it all figured out, that we have all the solutions for society and for healthcare, when in fact we do not. And it's hard for people to let go of that. Tomorrow during my presentation, I'm going to ask the audience, do they think healthcare in the United States is the best on the planet? And I know that there are going to be some people who click in yes, when it's real clear that it's not. Against developed countries, we're 11th. We're 11th in things like healthy life after age 60. We're number 11th in life expectancy. And yet, as you pointed out, we pay twice as much as most other countries to get last place. and
3 times more than the average.
3 times more than the average.
It's truly stunning. I mean, it's not even close. That's the thing. I mean, that we're talking about here. And you mentioned life expectancy. I say Britain and Italy. So we're not talking either about low cost of living places, are spending less than half, and they have a higher life expectancy than the U.S. Most countries now are at 80 years of age or more. We're stuck at about 79 years, the lowest rate among advanced countries. I'd be remiss not talking about access, because and you already mentioned the Affordable Care Act, while the Affordable Care Act has improved access, in 2015, the coverage rate was at 90%. That's only because of the Affordable Care Act. While it's universal or near universal elsewhere, and we're the only wealthy country without universal coverage.
Well, and that's the greatest argument for healthcare for all, and that's that all of these high-performing countries that cost much less than the United States are healthcare for all. It's a part of what you get as a citizen of France and Italy and Germany and the like. But there's another statistic that really is compelling, Fred, and that's not only are their life expectancies longer, but their health during age 65 or 65 to death, 60 to death. They call this healthy lives after 60. We are also the bottom on healthy lives after 60. So maybe we're going to live to 79 years, but we're not going to have as much fun in those 20 years as someone else who lives in a country and in a culture where healthcare is for everybody.
Yeah. It's very, very disturbing, and getting to that point about that this isn't just about life expectancy, but the quality of life, and the fact that if you don't have full access to healthcare, very bad things can happen. I also pulled this statistic, which I was surprised, because this is one that I hadn't seen recently. Deaths from preventable diseases and complications had adequate health care been provided. We are at the top of that list. No one is even close. 112 deaths per 100,000 people. So again, getting back to what I said earlier, when we hear this debated politically, and people are accused of sensationalizing this when they're talking about this as a life or death issue, this is not sensationalism. These are the facts.
They're very definite facts. Doggone it, something. Where was you made a comment? And you took it on a little bit. But no, the preventable illnesses. That's where I wanted to go. We are first in deaths from preventable illnesses, and that all plays back to access. Because if you treat diabetes early and it's controlled, you live longer. If you treat hypertension early and it's controlled, you live longer. But if you can't get into your doctor, if you don't have the wherewithal to do that, you're going to have all the downside of hypertension and diabetes, which is sometimes it's kidney dialysis, which is a horrible, horrible thing, and then it's death way before you needed to do that, because you had a stroke, because a heart attack, because you had amputations by virtue of diabetic foot ulcers. So this is real stuff, and it's very, very important.
Yeah. You know, as a doctor, I'm sure you've seen the results of this over and over again over a career of decades. Tell me about some things that stood out to you that illustrate this point, because we also should bring up, of course, that many folks have insurance, but that's not always the case that they're getting all the care that they need with high copays,
That's
deductibles, etc.
Well, I'll make a point of this. I've been doing healthcare a long time. I currently work for a federally qualified health center and teaching program in Tacoma, which is affiliated with the University of Washington. We take care of people with no insurance, Affordable Care Act insurance, commercial insurance, no insurance, who are, for the most part, impoverished. So I see the patients that I'm caring for now are people that haven't had a doctor for years and years and years. And they have these things, diabetic foot ulcers. I just admitted a guy the other night who had a stroke because he'd never been receiving health care, and he has hypertension. He didn't know it. His life has now changed forever. So it's really important to drill down on those things that you're discussing.
Yeah, it is. And what's all, I mentioned this issue is striking in that the very thesis for why we haven't fixed this completely is all wrong. But it's striking for another reason, and that is public opinion is on the side of your position on this, that we need universal care. A new national survey by Pew Research Center shows 60% support for the federal government being, quote, responsible for ensuring health care coverage for all Americans. What's standing in the way?
Well, now that would be socialism, wouldn't it? Oh my God, not socialized medicine.
Yeah.
And that's one of the arguments you hear.
Yeah.
Socialized medicine works, and it works much better. We just don't like that term, socialized.
Yeah.
But all of those countries have, quote unquote, socialized medicine, health care for all, and they have far better outcomes than the United States, which decries that whole notion of socialized medicine.
Yeah. But you hit on something earlier, too, that I think is very powerful that we didn't talk about at all in the radio conversation that we had, which is the notion of American exceptionalism. We grow up thinking and being told over and over again that we are the best in every single area. And some people, as you know, argue that that kind of makes dramatic change difficult.
Well, it does, but you only have to spend some time in Europe and in some of these countries that our health outcomes were weighed against to discover that they're quite happy, they're quite well cared for, they've got great roads, they have public access to music and theater and all those things, and they've got great food, and they're living good, and they have health care for all, they have universal coverage.
Yeah. One of the things that many people don't realize is the difficulty that for-profit insurance places not just on patients but on doctors, that you have to have a lot of resources dedicated to administrative costs to handle all these different companies and different insurance plans and permissions. Critics say, hey, single payer is just inherently more efficient in many ways. What are your thoughts on that?
U.S. is last in efficiency of health care. I made a misquote, and I'm glad you brought that up. I made a misquote on the radio. I said that our administrative costs are 18% of the total health care outlay. Actually, we're 18% on the amount of our gross domestic product on healthcare, but we're 25% of our healthcare dollars go towards administration, and that's
wow.
So you could take
one out of every $4 isn't going to healthcare; it's going to administrative costs.
Yes.
Whew. I mean, doesn't that say it all? And also,
well, it does. And I believe that there are two root causes. One, politics prevails over policy. Politics prevails over policy, and it's all about having the right-minded policy. And then it's also it's about healthcare for profit. And I just think that healthcare for profit doesn't have any place in healthcare, because you can't. If you're worried about your bottom line all the time, and you're so concerned that you're going to have your stockholders have return on their investment, you can't deliver the best of care. You just can't.
Yeah.
And healthcare for profit is conflicted with interests and all manner of things. And I'm going to talk about that tomorrow.
Yeah, PBS did a special on this long time ago, where they interviewed a former health insurance executive who admitted that during his career, when they discussed care, it was discussed as a loss. So the service provided was a loss.
Yeah, well, in the big HMOs want to attract enrollees age 21 to 40, but they don't want to enroll people in their programs when they're older than 40 or 50, because that's where the cost burden is.
Yeah.
But the only way you can balance it out is to have everybody in the game.
Yeah, and I want to get to this in a little bit more depth, because as a physician, and particularly one now that works primarily with low-income people, it's important again to note that just because you have insurance doesn't mean that you have access to care. One of the big issues that I've read about, and it seems to be growing, is that we of course have more people now on Medicaid because of the fact that there was an expansion of Medicaid under the Affordable Care Act, but there are some doctors who will not take Medicaid. There are hospitals, particularly those that have specialties like mental health, that may not take Medicaid. Programs within hospitals that don't take Medicaid. So having the coverage doesn't necessarily mean you have care.
26 states did not get on the Obamacare Affordable Care Act bandwagon. So they eliminated the opportunity for residents of their state to have that access that you're talking about. Mm-hmm. And some of the insurance companies are dropping out of Obamacare because they say it's too costly, there's this or that. There's lots to be said, but at the end of the day, if a doctor says he won't see you, if a state says we're not going to engage in this kind of activity, it's bad for the whole population.
Yeah, yeah. I want to ask you about a specific issue that's come up in the national debate over providing health care for everyone and the costs involved in service, and that is addiction service. This is an example of a huge challenge, as you know, with our for-profit system, because often there are only for-profit addiction units in a community, and those units may not take Medicaid patients. So you have a situation where you don't have service in a community for a critical problem.
That's true. Most of the patients that I serve are the product of domestic violence, intimate partner violence, poverty during childhood. We talk about much of this as being adverse childhood experiences, and when we are critical of a 23-year-old because they use heroin or cocaine, in my experience at where I work, most of these people have had a very, very hard life the first 20 or years or so of it. And the only thing that works for them and they can return to is drug use, because it feels better. It feels better than all this pain that I hold inside. So for us not to have programs to help with all addictions, not just opioid addictions, is also a mistake. Is it expensive? Of course it is. But aren't people worth it?
No.
Aren't people worth it?
Yeah. I want to ask you about your experience as a physician in terms of another issue that comes up when you look at statistics in terms of healthcare, and that is infrastructure. Not having enough hospital beds is one of the first statistics that we often see, and the OECD says that the U.S. has about 2.8 beds for every 1,000 people, which is one of the lowest rates in the advanced world. To compare, France has double that, 6 beds for every 1,000 people. Germany, even more. I am aware of this a little bit because my wife, her career was as a nurse, and she would tell me about people coming in from very far away to her healthcare facility because there were no beds in another city or another state. What can you tell us about this?
I have to claim not expert.
Yeah.
I'm not an expert at hospital medicine or beds, but this gets back to preventable disorders and diseases. If hypertension is treated regularly, you don't have to go to a hospital with a stroke. You don't have to go to the hospital with a heart attack. So really, if we have healthcare for all and the population in general is healthier, you're going to eliminate the need for hospital beds, and you're going to treat these people out in the real world and get them back to work and all that important stuff.
Well, and of course, prevention is so important for another reason, that being that a large percentage of our healthcare costs are when there isn't that care and it becomes critical.
Absolutely.
So
there are licensed sirens bringing you to the hospital. It's not you and your Toyota going to the doctor.
Yeah. You know, I want to ask you about something else, which you've kind of hinted at earlier in the conversation, which again is bringing me back to when you released this book shortly after this whole debate over healthcare that occurred when the Affordable Care Act was passed. And that is, I'm sure you remember well, the town halls all over the country. One of the biggest narratives that continues to this day is the notion that if we had universal health care, that it would be separating you from what your doctor wants. And I want to give you a chance to talk about that because you're smiling, right?
It's all about me, right?
You're smiling because, in fact, as we all know, just the reverse is true, that very often in a for-profit system, what your doctor has ordered is not what's delivered because of the fact that it may not be accepted by the insurance company.
They may not be reimbursed, right?
Yeah.
Or reimburse at a fraction of the time you spend and the effort you put into the patient.
Yeah. I mean, can you think of anything in your career where you've seen this happen? I mean, I was stunned once where my wife was prescribed a particular medicine and I went to pick it up at the pharmacy and they told me, well, your insurance isn't going to pay for this. Like, we've got to call your doctor and find another drug.
Yeah, happens all the time.
You know, I wonder, though, with us as a nation, again, talking about this, granted, it's not always an informed discussion that happens, it's not always in context, but we are talking about it again. Are you getting more hopeful? Do you think that we may, if not right away, we may be on the road to change?
I'm impressed that so many people throughout the country are really concerned about this issue now, where they weren't before. Mm-hmm. And now some people say, well, you give people something, they never want to give it back. Well, of course they don't want to give it back because, 24 million people now have health insurance that didn't have it before. Whatever the number, it's huge. And no, of course they don't want it taken back because they finally have a doctor. Mm-hmm. They can go see them, and they can go see their physician or their provider, and they're not as concerned about the downside with it. How much did this cost me?
Can it be taken, in your view, to the next step, though, going from the improvements that have occurred during the Affordable Care Act to universal health care, to maybe even single-payer health care, such as Canada and many, many, many other countries have?
Do I see that happening? I think if people say charged enough, if they advocate enough, if they're fired up about this issue and they say, no, doggone it, I think we have the opportunity to make that change one step at a time. Mm-hmm. And then we've got to get the politics. We've got to get the politics aligned right so that they deliver on the right policy.
What do you think could do that? I mean, we've seen protest, but it's got to go beyond protest for sure.
Well, if I don't get elected, if I vote against, if I vote to repeal and replace the Affordable Care Act, I'm your representative, and I vote against it, yet my constituents back home are in favor of it, I think I lose my vote, and I think that could possibly happen in at least many states.
Well, you've hit on it, right? That this really is about, like so many issues, about voter registration and then voting. I mean, in the last election, we were talking about 6 in 10.
Yeah.
About 6 in 10 that actually did that actually went out and voted. Not enough to actually represent the American people.
And I'd like to make this comment too about healthcare for all, universal coverage, single payer system. It does not matter if you're a Republican, a Democrat, a member of the Freedom Caucus, a Tea Partyist, or you're a libertarian, and it doesn't matter what your political stripe is. What matters is, as a people, we vote for the right things when it comes to healthcare.
And does this reflect our values as a country, what we're doing right now? I mean, I think that's a question.
Yeah, I think it's a great question, and it's to put politics in front of good policy is just not right.
Yeah. Dr. James Lenhart, it was such a pleasure to talk.
Thank you very much. It's been great having you. Thank you for having me here.
It's been great having you.
Good.
Great having you. That is our time for now. Join us this week on KRWG Radio. Every weekday it is Morning Edition from 5 to 9, Fresh Air at 11, followed by Here and Now, noon to 2, and All Things Considered, 4 to 7. KRWG News is always online at krwg.org, and we'd love to hear from you. Email us with your story ideas and video submissions. The address is feedback@nmsu.edu. For all of us at KRWG News, I'm Fred Martino. Have a great week. We'll see you next time on Newsmakers.